Uh, Good afternoon, everyone. This is our first class on Native Medical School, Part 2. I see quite a few are repeat uh, participants, but there are about 3 or 4 new people, and I hope they received the slides that I sent out earlier. If they haven't, then just please email me, and I will make sure that in the first part we discussed primarily heart and brain. And I think I got a little bit carried away when I talked about why we get sick, which has a lot to do with the evolutionary basis of illness as to how you stay healthy until you have reproduced. And then after that, the body doesn't care what happens to exactly you. So, and that's an interesting thought that has come into existence in the last few years. Now, I see that we have a smaller audience, perhaps because people dropped out, either because it is Friday or it conflicts with their schedule, or maybe the students' loans were rather you know, too expensive and the tuition was too expensive. But at any rate, it's nicer to have a smaller audience, and we'll jump right into it. Okay. Uh, in this class, what will we cover? Well, there is the medical school is rather long, and we'll do as much as we can cover in the plan that we have. That will cover pulmonary medicine, which is basically talking about lungs, what they are, how they work, what are illnesses. I will not give any advice about treatment primarily because I do not have a Florida license. Then we'll talk about gut or digestive system. We'll divide it into 2 parts as to we'll talk about the transit of food from mouth to the bottom, and also we'll talk about the connection between the nerves and the brain, the autonomic nervous systems, intestines, etc. And we'll focus on the new hot topic called microbiome. And then we'll also talk a little bit about kidneys, and then we'll jump into the big topic, which is a concern for all of us as we get older, which is talking about cancer. And last but not the least, if we have time, we'll talk about stem cells. Okay, so let's move right on into it. Now, when it comes to lung, we all need oxygen. In fact, without oxygen, life itself would not have been possible. Those of you who took my class on evolution and origin of life, it saw that for the first 2 billion years, there were bacteria, and they controlled the world. They had plenty of time, but they didn't do a whole lot except multiplied and made very copies of themselves and mutated as they went along. But then around 2.5 billion years ago, or say a great oxygenation event increased, and there are a variety of complex reasons which we'll not get into it. And that gave the start to the life. And then somewhere along the line, an accident happened that one bacteria swallowed another. That was a process of symbiosis. And once we got access to oxygen, then the life took off, and eventually from prokaryotes, eukaryotes evolved, and the Darwinian evolution took over, and then it eventually led to the most dominant species, that is us. Okay, so the oxygen was the most essential fact that triggered life on the pale blue dot, as we call our home. Okay, but now oxygen it's an interesting thing that the air that is around and the atmosphere that extends a few miles over the planet Earth, we are limited to that. Obviously, in this space there is no oxygen, so the air that is around, is shared by all of us. And there's a very interesting book written by a popular science writer named Sam Keen, and he talks that some of the molecules that were in Caesar's last breath might still be, in your lungs. He's done some amazing level of calculation, and it's of interest. And this book also talks about the important discovery of oxygen, nitrous oxide, and how they affects our life in general. So it's a good book, which is very easy to read, and would strongly recommend it for those interested in science. And he's also written varieties of other books about elements and periodic table. And the title was, if I recall correctly, called Dissolving Spoon. Okay, and the people, obviously loss of breath is the final event. And initially, people were so afraid that they would be in a coma and they would be buried So there was actually, believe it or not, a patent issued by the US government on a device that you could signal that, hey, I'm alive here. And so that actually was a patent. And so again, obviously, as a cardiologist, I thought heart was the most important, but it turns out, oxygen is right up there with you. And then when towards the end, the respiration pattern changes from a nice in and out type of thing. The majority of respiration is controlled by inspiration. The last 1/3 is expiration. That is a passive process. Okay, and but toward the end, the breathing pattern changes, and we develop something what is known as Cheyne-Stokes respiration. That is a few deep breaths in and then no breath, which is technically called apnea, and that's the Cheyne-Stokes respiration. And that is the agonal breathing, and that's another word for it. But Cheyne-Stokes breathing, you can recover from it if you're appropriately treated also. Okay, or if you're in severe metabolic disturbance. And the word entered common usage, especially with this event in 1953. The Tsar of Soviet Union, Stalin, died, and he had a stroke. And obviously, one of the manifestations of stroke, when especially if it affects the vital respiratory centers, is called Cheyne-Stokes respiration. And it was published in the newspaper, and it got onto what is known as zeitgeist at that time. Okay, so it's an interesting. This was a movie recently made called Stalin's Last Breath, or Stalin's Death, rather. My mistake. So it's an interesting tidbit as to how the medical terminology became popular. And moving on to a more interesting human interest story, this was a book that came out in 2016. It's a story of a Asian Indian American neurosurgery resident at Stanford who had the misfortune of developing lung cancer in the final year of his residency. And he obviously started therapy, but managed to complete his residency. And just when he was about to finish, he got more sick and could not finish his book, by the way. And his wife, who was an internist, managed to finish his book. And it's a very interesting human interest story, and got the Pulitzer Prize for biography of that year. So somebody of you may be interested in reading that if you haven't read this already. Now, oxygen, when it comes out to just like yin and yang, or good and evil, has a dual nature due to highly reactive free radical property, because all of you are familiar with free radicals, and it can toxic your cells, and it may even be one of the causes for cancer. It is capable of oxidizing metallic substrates to generate cellular energy, but it can also be toxic to your cell by something called reactive oxygen species. So an aerobic life depends upon how the cell handles oxygen. This is a finely tuned mechanism that billions of years of evolution has perfected. And oxygen protection from atmospheric oxygen toxicity is a very essential part of life. And the mitochondria play a huge role in maintaining this internal milieu or balance called homeostasis. Okay, and now why do pre-majors switch? Okay, and because of this, then organic chemistry has a thing called, which is a complicated thing, which was recently in the news when some of the New York University students protested as to how hard the subject was and how tough the exams were. And the professor had to be, was let go by NYU, perhaps because they didn't want to alienate all these high-paying students. And perhaps they had a legitimate cause also, because the professor was 80 years old and couldn't have to resume teaching. And so this is one of the things that, now what exactly is Krebs cycle? That is one way how our body converts food that we take into energy that our cells can use by various steps called glycolysis, other chemicals called pyruvate, and citric acid cycle, which is actually another name for Krebs cycle. And that is Dr. Hans Krebs on the picture. And then eventually oxidative process. So it generates the molecule that provides all the energy called ATP, adenosine triphosphate. And those of you who are more astute to genetics may realize that adenosine is one of the nucleotides in DNA and RNA as well. But that's another story. And to hear more about that, you'll have to sign up for the second class. So, and then this gets even more complicated as to how the respiration occurs at the cellular level, because all of you know from middle school or high school biology that the lungs and the red blood cell exchange oxygen and take out carbon dioxide, basic process that we depend upon. All the living things, except trees, depend upon it. But at the cellular level, the mechanism is quite complex, and it requires, it gets down to the proton and electron level, and there's this complex mechanism which occurs. By the way, this diagram suggests that these two lines are something called lipid layer, and which are hydrophilic, repels the water. And inside the cellular level, there is something called the proton pump, which pumps out hydrogen ion across and allows and generates ATP, which is the molecule of life, as we would call it. And this intricate mechanism was proposed and eventually proved by a rather eccentric and fairly outside the norms a British biochemist named Peter Mitchell, and who was a great theoretician, but he had an able assistant named Catherine, and who did a lot of the experiments. And he had his own independent lab, I guess somewhere in Bristol. And finally, initially, this study, as it happens quite often in science, was not accepted, but eventually he was proven right and was rightfully recognized by a Nobel Committee in 1978. This is something called the electron transport change and ATP, or to repeat, adenosine triphosphate synthesis, which are embedded in the molecular cellular level membrane. Okay, so that's an interesting underlying molecular mechanism where it incorporates the atomic level transfer of hydrogen atoms to generating energy, which is the essence of life as we know it. Okay, and this is, and we can just to simplify, this is the Krebs cycle. As you can understand, the various mechanisms, including lipids and sugars, are metabolized and broken up into these various intermediate steps. And on the side, it's written hemoglobin. And so this is the machinery that goes on in all our body type of thing. So, and this has a lot to do with how well we can exercise and how we can burn oxygen, and along with glucose that is endogenous produced in our liver, it breaks down glycogen and converts into energy. And this has also some mechanism that is something called our VO2 max, the amount of oxygen that we can consume. And this may also explain some of the phenomenon that is called hitting the wall that marathon runners are well familiar with. Okay. And which is where the metabolism changes from aerobic to anaerobic. And this is, one of the mechanisms how human bodies has its own limitations. And okay, now, and again, obviously, fat molecules have more calories. The average amount of glucose provides about 4 calories, while fat has 9 calories. So now, if you don't eat, an average adult has about 10 to 20 kilograms of fat. So you have a reserve that can last you up to about 3 months. But that's again, people who are on a fasting process, that the record is probably a lot shorter than that. And because by that time the metabolism changes dramatically, and then there is almost, dangerous to life as we know it. Okay, now getting down to the basic anatomy, which is the first thing that we need to go over. And air goes through the nose and through the sinuses. And in the sinuses are rather complex organisms, and there are varieties of maxillary sinus, something called the sphenoid sinus at the top, which is a direct gateway to the brain from the nose. And again, the maxillary sinus and mastoid sinus. So, and these open up inside your nose, and their job is to initially filter all the particles and microbes that may want to enter and protect the body. And at the same time, it humidifies the air as we go along. So now, interestingly, the origin of or evolution of this is rather goofy, that the drainage of the sinuses is on the top rather than at the bottom, which has made human beings prone to getting sinusitis. And that has a lot of evolutionary basis in it, and that we discussed in the class on human evolution. And again, the two tubes, the food pipe and the windpipe, are separate. And in order to avoid choking or having the food go the wrong way, there is a flap that is called epiglottis. Epi means above and glottis means tongue, that protects our larynx. And so it gives us protection from choking. And again, and then there are the vocal cords, which gives us the power of speech. And again, sometimes the larynx, as we get older, migrates downwards. And that's the danger in children, that they can aspirate very easily, type of thing. And because their airways and the tracheal tubes have not developed completely. And the most common danger would be, they can eat solid food, but they haven't developed this reflex. And most likely peanuts or other things can, and especially candy or peanuts, can actually cause the death of a child. And it's a very serious danger. Okay. And again, in adults, it can happen that all sorts of things can go down the bronchial tree, which includes in adults, a piece of dental work is very common that one can aspirate. So aspiration pneumonia is a serious and very common occurrence in pulmonary medicine. Now, what are the symptoms that are related to lungs? And the heart disease or heart attack can cause chest pain, but lungs by themselves do not cause pain. They manifest by something called dyspnea, which is a Greek word, and it simply, which morphed into Latin, simply means bad breeze. Okay, and this is the word that has been around in the medical literature for eons. And this is for those of you who are from UK, this is their spelling, which is always different. Okay. And the other manifestation is cough. The third manifestation is spitting of blood, which has fortunately decreased since the control of tuberculosis. Another manifestation which should be mentioned is called cyanosis, and this simply means turning blue. And again, much more common when you have an admixture of right and left side of the blood, primarily in babies. In adults, it's relatively less common. Okay, and then again, you can get pain from lung disease, which is primarily from the sac that wraps the lungs around, which is called pleura. Okay, and so that's another way of one can get pain. So those are some of the symptoms, and obviously some of the less common symptoms, such as hiccups. Okay, and occur in doves. And so then, and the change in the respiratory pattern, I already alluded to Cheyne-Stokes respiration. And at rest, we exchange about 250 cc of oxygen. And with exercise, it can go up from anywhere from 2 to 5 liters. Okay, and with peak exercise, it can go up to 25 to 30 liters. Okay, and then again, obviously, the elite runners are in a different class by themselves, and while in their maximum oxygen carrying capacity can be as high as, 3 or 4 times more than it should be twice the normal adults. That something defined as milliliters per kilogram per minute which is defined as VO2 max. And while average male has a VO2 max of about 40 milliliters, okay, while the elite male runners can be as high as 85 milliliters. Again, females being smaller can be would be about in their 30s. So that's a little less for females, as to be expected. And some of these is old research that was pioneered as far back as 1922 by a well-known British physiologist named Bradford Hill, and they did independent work on energy metabolism. Okay. Now, another symptom is called clubbing, which is not to be confused with the activity of going to nightclubs and to dance to popular music, drink, and socialize. But this is what clubbing actually looks like. That the nails you can see, do not show well in just a small picture, but they are deformed, and that's a classic sign of chronic lung disease or even some of the lung cancers. And this was the day in the good old days when physical exam was emphasized in medical school. But nowadays, I doubt very much that medical students take the time to look at it. Getting down further from the larynx onwards, the trachea is a rigid tube which is made of cartilage, or rightly below the Adam's apple, you can feel that's the same material that your nose bridge or ears are made of. And it's hard to, it has some elasticity, but there would be an easy way of killing somebody. And further down, it branches out into two right and left mainstem bronchus, and it continues to divide into varieties of branches, as many as anywhere from 20, 25 more branches. The large ones are stiff, but as they get further down, and after 15 division, it becomes relatively soft and gets buried inside the true lung sacs. And at the end of sac, it's something called alveoli, which are basically just blown up bubbles composed of air, and they're very soft wall. And it's only the upper airways that provide resistance to the air. In the further down beyond 15 branches, the air just moves by diffusion type of thing. And the smaller airways are collapsible type of thing. Now, again, it must be, as you can see from the picture, that the left side has 2 lobes while the right side has 3 lobes, And why that occurs, is perhaps it makes room for the heart, which is, on the left side. Okay, and now the lungs are not attached to anything. They are hanging loose in the pleural cavity via something that is known as hilum. Okay, and obviously the main function of lungs is to exchange carbon dioxide and oxygen. Okay, when the blood that returns, the venous blood that returns from the body is high in carbon dioxide, and all the gases, they're measured with something called the partial pressure of oxygen and the carbon dioxide, which is about 50 millimeters of mercury. It's in the returning blood, okay, and then obviously in the arterial blood, it is reduced to about 40 millimeters, okay. And the pH of blood has an important role to be played, and it maintains hemostasis around 7.4. Okay, now, and obviously, and the arterial blood that leaves the heart, okay, as oxygen saturation of about anywhere about 90-95%. Okay, and now, and the body is very forgiving that even if you are not breathing adequately and the oxygen saturation drops, it is able to deliver oxygen to the tissues, because that's where the action lies, that the tissues should get enough oxygen irrespective of the amount that is actually in the blood. And so the body can be forgiving up to a lower oxygen level of 55 millimeters type of thing. So, okay, now to accomplish this process, the lungs need a huge surface area. So it's about, each air sac is quite small. It's only about 200 microns. So, but when you added up all these divisions that have taken place, the area is rather massive, about 100 square meters, which is close to more than 1,000 square feet. Okay, and so there's a huge surface that is available for air exchange that takes place. Okay, now let's go over a little bit about the process of gas exchange as it takes place. On the left side is the basic gross anatomy, as we went over. The aorta and the heart is lying nicely in the middle, and then the lungs are situated on two sides. And here is the small diagram. You can see the pulmonary capillaries, and which is magnified here. As you can see, that the alveoli are surrounded by tiny capillaries, which are almost microscopic, and the air sacs are about 200 microns, and they are surrounded by capillaries, which are filled, which are actually the red cells travel almost in a single file, and they're basically sacs of protein, which are as small as 6 to 8 microns. Okay, and red cells are unique in the sense that they are one of the few cells that do not have a nucleus, and that is controlled by basically the proteins that are involved in building something called actin filaments, and which carry the molecule of the most important protein, that is hemoglobin. Okay, and so there are how many alveoli there? I mean, it's a huge number, as high as 300 millions. Okay, and so now the amount of oxygen, as we've shown on the side, is the venous blood. The partial pressure of carbon dioxide is high because it's returning after the body has used it up, and the oxygen level is low, is to be expected. And then the arterial oxygen it goes back to what is ideal for the body. It's close to anywhere from 90 to 100% partial pressure, and the carbon dioxide is still dissolved because it's more soluble, but it doesn't go down to zero. But it's 40. That thing. And the alveoli has a higher level of oxygen, so the gas exchange can flow from the higher level concentration to lower. Okay, and so that the amount of blood flow that is to the heart is about 5 to 6 liters at rest, and with exercise it can go up to 20 liters. Okay, so all the oxygen and carbon dioxide basically dissolved inside the red blood cells. Okay, and obviously if there is any problem with the perfusion, then there is something called the ventilation perfusion mismatch that can occur with various disease processes that we'll go over in a few minutes. Okay, and again, as we said, that there are varieties of ways that this can become abnormal. Let me see what I have next. Okay, and yeah, so let's talk a little bit about hemoglobin first before we talk about this thing. That hemoglobin is one of the earliest molecules that was the start of molecular biology that was discovered by the great Linus Pauling, who was the father of biochemistry. He worked at Caltech primarily, and he received 2 Nobel Prizes for his discovery. One was for his contribution to organic chemistry, and the second was for nuclear disarmament protest. And the hemoglobin is made of various peptides, which are the chains of amino acids. By AA stands for amino acids. And 1 gram of hemoglobin dissolves up to 1.36 cubic centimeter or milliliters of oxygen. And then there is this is a shape of hemoglobin that was determined by crystallography by Linus Pauling. And you can see that, and there's a huge number of hemoglobin because peptide proteins are quite small. Okay, there are 250 million hemoglobin molecules, and there's a 4-ring peptide ring, and in between it contains iron and something called the porphyrin ring. Okay, that binds the elemental oxygen. And again, there can be some disorders of this porphyrin metabolism, and which was well depicted in the movie The Madness of King George. Okay, all right. So, and we already talked about the oxygen levels. Okay, now, okay, and let's go back to the one more slide. That the alveolar exchange has a role that the air has to be moving fast, and it is protected by mucus, and the lungs are spongy. And if in asthma, as the airways constrict, it gives resistance and makes the air exchange difficult. So there can be various disease pathologies can affect the air exchange. Okay, we already went through that. And by the way, the oxygen saturation that became very popular, the way we can measure it is by the finger stick. In the old days, we had to actually draw the blood sample, send it out to the laboratory, keeping it cool on ice and make a run, and then wait for the results. But now with oximetry, we can just do this simple finger thing, which became very popular. And you may have seen if you visited any relative or been yourself in ICU as to how the finger stick monitor has made life a lot easier, and continuous oxygen monitoring, it can be accomplished at your home. And they were, that became very popular during the first phase of COVID. Okay, and again, so this is just to see how the air exchange takes place. Now, just to go over the basic circulation, that the blood comes from pulmonary artery. This is the blue blood, which is high in carbon dioxide and low in oxygen, that comes around to the alveolar, and around there, the alveolar capillary membrane, the normal ventilation and perfusion exchange takes place, and the blood goes out on its merry way along the pulmonary vein and into the circulation again. Now, the various ways that can be abnormal would be ventilation perfusion abnormalities. It can lead to low oxygen level, impaired ventilation, either the air is too thin at high altitude, or due to bronchospasm, which occurs in asthma, or impaired perfusion, which takes place for whatever reasons, type of thing, as to either there is a blood clot or what have you. And that again leads to hypoxemia. Okay, and if there is an abnormal mixture, either we say, for example, babies that are born with a hole in the heart that could have shunting process, so that again can have low oxygen. So there are varieties of reasons how oxygen level can be low. But again, as I mentioned earlier, the body is very forgiving, and as we can focus on this graph, look at the middle level, that even if the saturation of hemoglobin drops to almost half, okay, we can still maintain oxygen levels up to 90% type thing. Now, the varieties of factors such as fever or acidosis affect and being at high altitude. So the way the oxygen curve shifts from the side, especially, so you're breathing harder when you have fever. And again, so acidosis, the blood pH turns acidic type of thing. Okay, and a lot of the other causes that can affect are hypoventilation. What are some of the causes of hypoventilation? A simple one would be overdose, or long-term chronic neurological illnesses such as Lou Gehrig disease or amyotrophic lateral sclerosis. Classic example was polio, can occur also in the fractured ribs. Okay. Second is impaired diffusion. The classic example would be respiratory distress syndrome that took place during COVID, or any pneumonia for that matter, or sometimes permanent scar tissue, interstitial fibrosis, and also occurs in chronic obstructive lung disease as a result of smoking, and it can also occur in heart failure. Okay, and a mismatch, again, there is it can occur due to pulmonary embolism type of thing. So this is varieties for the reason that it can take place. Okay, and again, simply a gunshot wound, and now carbon monoxide, why is it dangerous? Because it has a huge affinity for oxygen, with hemoglobin, carbon monoxide. So that's one of the reasons carbon monoxide toxicity is very dangerous. Okay, and we already talked about the amount of carbon monoxide in the blood. Okay, which is it's chronically elevated in cigarette smokers, as to be expected. Now, then, just to show something differently, that respiration is intricately related with the heart, because even just with simple breath training, one can manage lower pressures. So you don't have to be a exceptionally trained yogi to be able to do that. But by breathing against sort of resistant exercise, that inspiration and expiration, how you can see there, inspiration occurs due to two muscles, the diaphragmatic muscles and your rib cage type of thing. So, and by learning to breathe against, exhale against resistance, one can train your lungs, and indirectly with various initiating reflexes, you can train yourself, and it has a long-term benefit of lowering your blood pressure. And this was some of the recent reports that was published even on the NPR website. Okay, and whether it's worth practicing or not, that is a little too early to be proven, because there are obviously excellent medications already available for lowering blood pressure, and which became available only since 1950s primarily. And I may have quoted that when Franklin Roosevelt died, his blood pressure was as high as 270/140. And the advice of his doctors was he should rest in the afternoon and cut back on smoking. So we've come a long way since that time. But okay, so, and this is one way to train your lungs. So this is a device that is commercially available and may be of some benefit. Now, dwelling into some of the injuries that and the disease that takes place, the one is obviously the pleural sac has negative pressure and is empty. That's one of the reasons why lungs can stay expanded. And you can see that the lung almost, there is very little space that is left in a normally expanded lung. But when the lung collapses, the air gets into the sac like this, the lungs would collapse, and that is the technical term is called pneumothorax. And they can occur this either spontaneously, if the lungs are diseased due to formation of emphysema or something that is something called a bleb, which are like a big air sacs became extremely large and they can rupture on its own. And that's known as a pneumothorax, or simple and more common reason would be trauma seen during war crisis. And for those of you who remember the movie MASH, as to how the inserting the chest tube would be the immediate way of saving life. And this can occur spontaneously in illnesses such as Marfan syndrome. Okay, and now the other important illness which can occur with, is called respiratory distress syndrome, as to how we can see in this little cartoon the normal anatomy where the carbon monoxide diffuses in and the oxygen goes out. But if the lungs are filled with junk and fluid, and obviously it's very obvious that the air exchange can be. Now, just to give you some historical purposes, before treatment for tuberculosis became available, there was one theory of creating artificial pneumothorax and to give lungs a sort of rest and recover on its own. It was called artificially induced pneumothorax, was done in the early 20th century. It was one way to treat tuberculosis other than languishing in the sanatoria. And okay, now moving on to more anatomy, it's obviously, not all of us, need to go through the anatomy lab and smell formalin, but this nowadays with the computerized scanning or CT scan that is widely available. And this is one way I thought it would be worthwhile to show you the normal anatomy. Okay, let's just play this. CT scan is done from head onwards to the pelvis. You're lying supine. And this particular video nicely demonstrates varieties of organ. SVC means superior vena cava, that is the blood that is returning from your head part. Okay, and the tape will move down further down the body, and you can see the heart is showing up into the images. Okay, and then going down to the various chambers, right atrium, right ventricle, aorta, okay, left atrium, and so forth. Okay, and you can see the heart is increasing and will slowly disappear from the views, and the varieties of blood vessels that are cut into cross section. IVC stands for inferior vena cava, that brings blood from the lower half of the body and the esophagus, which will gradually end up into the stomach. And then this big shadow that comes with the largest organ in the body, which is liver, and on the side there is spleen. Okay, and then you can see that it's going further down. So then we are getting to the abdominal anatomy as we go further. And then the kidneys show up, and along with now this is pancreas, so we're getting outside the region of interest, and we'll talk about it when we talk more about gut. Okay, and again, this is just repeating the same thing, so we'll move on. Okay, now some interesting tidbits about the lungs, that again, this is, now I don't know why this is in pints, I apologize for it, but that's in medicine, usually we measure in terms of the metric system, and we consume about 11,000 liters of air, and along with that, we exhale about 17 milliliters of water per hour, type of thing. So they can understand that the molecules of air being so tiny that you'd be sharing the same breath that was taken by or shared by your great grandfather. And the lungs are of different size, and we talked about it. The one left side has only 2 lobes, while the right side has 3 lobes: superior, middle, and inferior. Okay, and the lungs are the lightest organ; they would actually float on water, type of thing. And unfortunately, Mother Nature gives us enough reserve that you can live with 1 kidney, or even like 10 to 20% of the kidney, so that you can live with 1 lung. That's why a lot of time, transplant was done with 1 lung, type of thing. Okay, so now, interestingly, just to digress, that in other parts of the world, organ meat is consumed without any enjoyed with relish, but in the United States it is illegal to eat lungs, and this was passed in 1971, primarily due to the fact that there is danger of contamination from gastric fluids that can go inside. But in other parts, such as Malaysia and some parts of Europe, lungs are eaten, and in Malaysia it is sold as light beef, and it's also eaten in South America and some parts of Europe. Okay, now the lungs have a wonderful defense mechanism, and you can see this is something called cilia. And earlier we talked about that the first line of defense was epiglottis, and then the nose and the sinuses, and then along that the interior of all the lungs is aligned with something called cilia, which are the tiny wave-like filament-like structures that trap the particles and pollution particles, as well as various bacteria and viruses. And you can see that these are the cilia that move in something like waves. And initially, later on, the virus particles in this color micrograph, they were painted later, obviously. So this is one way the body protects us from outside pathology. Okay, and they move in something in waves, just like a coral would move. And this is something called the mucociliary layer. Mucus is obviously the snot that you can feel, and that also traps all the particles. And so it's actually, the word that is used is called mucociliary layer, type of thing. And so this is, and the cilia move in unison back and forth. Okay, and I think this is a videotape which illustrates the electron micrograph in details. Alveolar macro, and then beyond that, there are additional defense layers called alveolar macrophages, which are the white blood cells. Their job is to eat all the organisms that they come. Okay, let's play this again, just so you can see. And these are the white blood cells, and these are some of the cilia that, and so these are some of the nature videos. So the body has its own wonderful mechanism to protect us from all the outside pathogens that want to attack you. Now, moving on to other disease, which is quite common, and as many as 1 out of 25 citizens, and in North European population, the mutation is common, but it is considered autosomal recessive, and by that simply one means that you need 2 copies, one from mom and one from dad, to manifest the disease. And this is and we have quite serious disease. And you can see that even with that, there are large number of people that are born with cystic fibrosis. And initially, it was just thought that was the disease that the mucus was there, and we just knew the gross pathology of the disease. But as genetics and molecular sciences evolved, we have discovered that there are varieties of mutation that gets down to the cellular level, and that is, the body is unable to handle chloride and water, and that leads to formation of thick mucus. And again, with the mucus, big thick, it gives an ideal medium for sepsis, and these people can get repeated infection, and it eventually takes its toll. And now, fortunately, science has come to the help that now there are, in the past, the treatment just primarily involved antibiotics, avoiding infections, treating infections, and trying to break up the mucus by something called the chest massage that the families were taught to be done on a regular basis at home, almost 15 to 30 minutes, a couple of times a day, to loosen up the phlegm, humidifiers, and other stuff. But now the treatment has become available that due to this abnormalities of the protein and the gene, obviously genes by themselves don't do much, and they form protein. So something called the small molecular proteins, which block the action of these proteins, have been devised. And the varieties of biological agents have been marketed, and they're quite successful. But again, as it happens with a lot of the newer medications that are biological agents, along with the profits that the companies that have patent would charge, and the cost of these drugs are nothing to sneeze at. There are varieties of names that are given, and the most recent drug, which is a combination of triple drug therapy, which can run as high as $300,000 per year. So it's nothing to sneeze at by any means. Okay, all right, and let's move on further. Let's see what we have here. And this cartoon shows basic pathology. As you can get sinus infections, the thick mucus leads to pneumonias. They have a problem with producing enough water in the sweat, so the sweat can be salty. And that was the one earlier way of back in the early 20th century, the cystic fibrosis was being diagnosed by measurement of sweat in the suspected patients. And the liver can also have the problem with thick ducts. And again, obviously, you can understand anywhere there are ducts and lack of mucus, with pancreas can have problems. and this, again, the smaller diagram shows the normal airway that is nice and smooth, while here the airways are combined with thick mucus, and the airways is compromised. Okay, so that's okay. And these are the varieties of genetic mechanisms, which becomes fairly complicated. This is something called the chloride channel, which is the way at the cellular level that the transport of ions takes place. And there is something called the potassium level is high and the sodium level is on the outside, and the chloride ions are exchanged. And so these abnormalities occur due to genetic abnormalities. And there are a large number of mutations have been diagnosed. And fortunately, so now it's become a more treatable illness, as we talked about a little while ago. Now, there are other illnesses that, because of the scar tissue, this bronchi and the alveoli become permanently dilated. And the technical name that is given for that is something called bronchiectasis. And that is one way of the lungs can be permanently damaged, again, preventing adequate air exchange. And so this is a vicious cycle of infection takes place, leads to inflammation and the mucus exchange, and the tissues are damaged permanently. That's the disease pathology of bronchiectasis, as you can see. And okay, and the other causes, primarily, there are other causes also that can occur, which is that are primarily disorders of cilia alone. There are varieties of Raynaud syndrome. In newborn babies, something called alpha-1 antitrypsin deficiency can also lead to this. And so this can, and the varieties of autoimmune diseases can also cause, and which is some of the rheumatoid arthritis patient, inflammatory bowel disease. So other specialties may also encounter as a complication of the primary illness, where your body fails to recognize self and non-self and attacks its own cells. So that's what's meant by autoimmune diseases. Okay, and again, so what happens when we're born as to how inflation of the lungs requires the recall of the resistance, and there's a phenomenon called surface tension, which is involved, and which is a thin layer of the fluid that lines the air spaces and the air-liquid interface surface, something like the drops that occur in the car during rain. Okay, and so in the work that is required in breathing, we have to overcome the surface tension type of thing. Okay, and so this is some of the disease process that the newborns have to overcome in order to take their first breath. And you can see that if there is problem with the dissolving the liquids, then the alpha-1 antitrypsin deficiency can cause damage, and those babies have failure to thrive, as it is called. Okay, so the work, and if there is resistance which occurs in asthma, that can again complicate the matter. So there are varieties of disease processes that can affect from early birth onwards. Okay, now just to digress, this is an example which we alluded to earlier, that the normal oxygen level with exercise can go from 250 cc to 2 liters, which is a dramatic reserve that we have. And the ventilation can increase from 5 liters to 25. And beyond that, metabolism switches to lactic acidosis. And that's maybe one of the mechanisms for altered sickness. And this little diagram shows as to what happens when you climb at the high altitude, in terms of meters, So that's almost climbing the Mount Everest, things that you can, 9,000 would translate to 27,000 feet plus. And you can see the air is pretty thin over there. So unless you're genetically gifted like some Tibetans, okay, you would be gasping for air and you wouldn't be able to survive, because 55 is the cutoff point type of thing. So that's one way you require oxygen. Okay. And again, this shows some of the other disease processes. When we show the normal CAT scan earlier, with the lungs were nice and black, and this little cross-sectional area, the small branches of the blood vessels that are cut on end. But you can see it does not take a genius to figure out as to pulmonary fibrosis means all this scar tissue that is shown in. So, and there are varieties of reasons, as we talked about. Some of these are genetic, some of these are occupational, primarily working in coal mines or working in various silos, or as Joan pointed out, working in uranium mines. And so these are, but now with the occupational safety standards, this has fortunately decreased. And this can be, there is no clear-cut cure for this, and this can be fatal in 3 to 5 years, because there's obviously you cannot get enough air, and eventually the body runs out of gas, literally. And there are varieties of chronic lung diseases, type of thing that takes place. Okay, and which include asthma, chronic lung disease, cystic fibrosis, type of thing. So, okay, and the burden of that lung disease is nothing to sneeze at. You can see that this is a slide from various asthma associates. That this is, the problem worldwide is huge. At least in the United States, as many as 25 million people of asthmatic suffer from asthma. 1 in 10 children, and again, so it's like, and they're limited, obviously, and the treatment, even though it is available, it becomes hard to afford. So, okay, so, and asthma affects more boys than girls, and it's more common in women, and more common in African American population. Okay, so environment and crowded spaces, occupation, they all have a role to play. And the genes do play a role, but again, that's not the main factor. Nowadays, the more quickly changing factor is the environment, or the air we breathe. And this is, again, and Now, obviously, it's becoming apparent that how you're born and your microbes have a huge role to play as well. Okay, and this starting from your birth onwards, the way your labor and delivery proceeds has a huge role to play. That is with cesarean section, you don't get exposed to enough microbial, the beneficial microbial flora that has a higher incidence of having asthma and allergies during the growing years. And the study was done, and now there's actually a trial that is being done by giving the correct microbes to kids who are born by cesarean section to see how whether they can get the beneficial flora from their mothers. Okay, and so again, the basic pathology we already went over as to how the airways are narrowed, and you can see how at microscopic level of this normal airway looks nice and smooth, while the muscle layer is thickened here. And again, we know this part of it may be they're avoiding exposure during early childhood to beneficial agents type of thing. And maybe we are becoming too clean, and the incidence of asthma is even higher in other Western countries compared to the United States. In Australia, it says as 35%, UK is 20%. Okay, and so this is becoming a big problem. There is obviously a genetic component, which is 30% in identical genes. Okay, and but the allergens and others are playing an equal role. There are two types of asthma that we must mention. One is the allergic type, which is the most common, which is like dust, pets, cockroaches, and the other type is non-allergenic, which is induced by stress, exercise, even thunderstorms, and aspirin can cause it. And so varieties of chemicals have the list is vast. Okay, and again, this shows the early microbiota. It predicts what are your odds of developing and affects the immune function. And there are varieties of things. So there is a huge literature and the research being done on the so-called good microbes, and it interacts with something called the T cells, which are the protective white blood cells, and the other chemicals that are secreted, which are called cytokines, which is called interleukin type of thing. So, and immunology is quite complicated, and we probably won't have time to get too much into immunology because I think Dr. Steven Spector did a nice class on it a while back. Okay, all right. Let's see, what do we have here? So, okay, and there are varieties of triggers which we already went to a type of thing. I already beat that to the punch, and these include infections, allergens, drugs, cold, exercise, fumes, pollution. Okay, climate change is becoming a big problem, and there are varieties of treatment. The earlier treatment was obviously the simple things such as adrenaline or beta agonist and various inhalers, and they're even made into movies. It's like the movie that was a classic movie. There was Hand That Rocked the Cradle, where the woman who is kills the other person by stealing her asthma inhaler. Okay. And there are varieties of natural agents which were used, called bishop's weed, and the other old standby was called aminophylline that we used to use when we were in training. Now there are more specific drugs that have been available, which are devised against IgE, immunoglobulin protein, and so various sophisticated medicines are being available. And obviously, the newer the medicine, the more expensive that is. The most recent kid on the block, that is the anti-inflammatory agent, that for those of you who pay attention during late evening television commercials, it's called Dupixent. It's a biological agent, and which is derived from living cells and biologically synthesized, genetically synthesized agent. And the cash price for 30-day supply is nothing to sneeze at, about $5,000 plus. So the simple inhalers cost pennies, but some of the newer drugs require long-term use and they're expensive, and only a smaller amount. Unless you've got good coverage, you're out of luck. Okay, and the worldwide problem, this again illustrates, which I referred to earlier, that Australia, New Zealand, even the United States, Canada, UK, all have fairly high incidence. And this is an older slide, but you can see that the incidence has not decreased by any means. Okay, and the worldwide, no, it's interesting how one can say, well, there's not racial differences, but when it comes to certain diseases, clearly there is. Now, this always puzzled me as to how Mexican Americans and Puerto Ricans have different prevalence. And then again, even in mortality, it's different. So now these are observations. So I don't think there's any clear-cut explanation that has been given. And there is some genetic diversity type of thing. And and again, when we talk about African Americans, they have it's an admixture type of thing. So, and some of them do not respond to various common drugs, that type of thing. So, and so it requires individualization of treatment, to put it mildly. Now, there are other diseases that are well known and chronic, occurring in older population, which are called restrictive diseases, while the lungs cannot expand, and obstructive disease, well, the air has resistance, Okay, and air pollution, cigarette smoking, and again, obviously, fortunately, it has decreased. And this was Philip Morris, and the tobacco companies did their best. It took almost, I should say, 25 years before the government to get into the action. The relationship was emphasized even in the Nazi Germany, okay, back in the 30s, and obviously the effect was scientifically in the other countries was elicited in 1948. It took until 1960s for the Surgeon General to issue warning. Okay, and so this is was one of the big causes, and along with occupational safety standards, the chronic lung disease had decreased, but certainly not disappeared. And in the classic way that we were taught was, and these were classified as pink puffers and blue bloaters, depending upon how much wheezing they had, okay, or whether they had cyanosis or not. So these were some of the ways. Chronic bronchitis is defined as continuously being sick for about 3 months, versus emphysema, which manifests by expansion of something called blebs, and they have trouble, with inspiration and expiration both. And some of the people who have the restrictive or fibrotic disease, they lose their compliance, and a lot of them are occupational related by any means, and also where you live is important. Okay. And these are some of the definitions. Chronic bronchitis, cough for more than 3 months, or for a year, or for at least 2 years. That's one of the definitions of chronic bronchitis, and then manifested by repeated infections, that carbon dioxide goes up, and their chest is barrel-shaped. Okay, and it's again repeated infection. Emphysema has less cough and tension, but they look more or less like a cactate, and their lungs have expanded. And so again, and these are some of the risk factors, cigarette smoking related, that they, and so this is one of the CT scans as we shown. And for those of you who are more interested in disease that are multifactorial disease, called genetic, environmental, it leads in turn to inflammation. As you can see, inflammation leads to an increase in white blood cells. It puts in oxidative stress and causes more mucus formation, leading to scar tissue. And you can branch down 2 ways type of thing, as to you can develop emphysema, or the narrowing of the airways, and the airway obstruction, that is a chronic bronchitis. So these are the 2 main categories how this lung disease can manifest. Okay, now again, obviously the simple treatment of lung disease is supplemental oxygen. Okay, and I'm sure all of you are familiar with people carrying oxygen, and in hospital, obviously continuous airway pressure, CPAP, and delivery of oxygen. And if that doesn't work, then the respirators, and even in spite of, sometimes the respiratory distress can be so severe that in spite of respirator and giving oxygen at 100%, one cannot maintain oxygen saturation. That's where the the new technology called extracorporeal membrane oxygenator comes into vogue. And this video explains to some extent as to how that is being utilized.
For extracorporeal membrane oxygenation. Corporal is just Latin for body, so extracorporeal means occurring outside the body. Outside the body, membrane oxygenation. And when you look at an ECMO machine, what you're really looking at is a pair of lungs. That's what the ECMO machine does. I can take blood from a human, send it to this ECMO machine. The ECMO machine will put oxygen in that blood. It will remove the CO2, and I can return that oxygenated, clean blood back to the body. Now, there's two types of ECMO, VV ECMO and VA ECMO. Now, far and away, most common is VV ECMO. And this was really developed back in the 1950s, and it gained a lot of popularity in the 1970s using VV ECMO on newborns. Remember, this ECMO machine is essentially a pair of lungs. Now, the last thing that gets developed on a human being before we're delivered and spat out into the universe is our lungs. So we would have these premature babies being born that had poor lung function. Their lungs weren't developed. Okay, we could put them on ECMO, take the blood out of a vein, oxygenate it, put it back into a vein, and as long as that neonate had a working heart, we're bypassing the lungs. Was this technique successful? Yeah, survival went from 20% almost up to 80%. So ECMO was a wonderful, viable option for brand new neonates with poor lung function. Now, VV ECMO, remember, is just replacing their lungs. So fast forward today, we can use VV ECMO for ARDS patients. Anytime you have respiratory failure where we think we can fix the underlying pulmonary issue, we can put the patient on ECMO, give the lungs a break, let the lungs heal, wean them off the ECMO, reintroduce the patient's own native pulmonary function, and save that patient. And that's VV ECMO. Okay, the second type of ECMO, VA ECMO. In this case, we're going from venous back to an artery. So we're taking the blood from a vein, sending it to the machine, getting it oxygenated and cleaned, then we're returning it to a patient's artery, and we're doing it under pressure, thus providing the patient with some hemodynamic support. And that's really what we're going to be using ECMO for as it relates to ACLS. Now, not a lot of guidelines for use. The science is still kind of new. There are facilities out there that are starting to write guidelines for use of ECMO, and the AHA is looking at these, but we don't have any firm criteria for ECMO use yet.
Well, when he means by ACLS is advanced cardiac life support. That is people who had cardiac arrest and are not surviving, and AHA means American Heart Association, just to clarify the medical abbreviations. Okay, I think that's what basically he talks about. So this is a last stage effort type of thing to give a rest in hopefully trying to treat and buy some time when we're trying to fix the underlying disease pathology, be it maybe heart or lungs. Okay, now getting to the other chronic problem which does not affect the United States, but we don't live in isolation. So we'll talk a word about tuberculosis. And tuberculosis worldwide is still a major health issue, and this is staggering that as many as 2 billion people are infected, but not all of them are symptomatic, fortunately. And still, the death numbers are nothing to sneeze at. And with the rise of HIV and reduced immunity, the numbers have increased. And again, with the collapse of Soviet Union, the numbers of drug-resistant tuberculosis have increased dramatically. And you can see that these numbers are just not staggering, that 1 out of 4 people are multi-drug resistant. And obviously, we had great hopes when streptomycin came out in 1948 that we will lick the tuberculosis problem. But the bugs have had 2 billion years of head start over us, and they develop resistance very quickly, not just to one, but to multiple drugs. And the XDR is even more lethal, that is extensively resistant drugs, so nearly about 5 or 6 drugs. And so it's almost untreatable. And the man who made difference for the worldwide impact of not just Ebola and tuberculosis and other illnesses is my hero, Dr. Paul Farmer. And for those of you who are interested in his biography, so it's called Mountain Beyond mountains. This was written by a writer named Tracy Kidder, and talks about now. Paul Farmer is an interesting person. He was born in Florida, but man was born in Weeki Wachee, went to Hernando High School, later on to Dukes and Harvard. And as a medical student, he managed to work in Haiti and worked on Ebola, HIV in the early 80s, and later on formed organization and almost single-handedly worked on drug-resistant tuberculosis, because the World Health Organization had almost written off that the drugs are so expensive we cannot afford it. But he managed to do enough public information campaign, went after donors, and managed to establish his organization, made a dramatic improvement. And unfortunately, he died at 62 of heart attack. And again, obviously that was one of the Nobel oversights for a man who made a huge impact. Okay. And these are some of the factors that play a big role in tuberculosis. Again, malnutrition, poverty, HIV, alcoholism. And again, there is a delay. It's difficult to diagnose because TB was hard to culture. And now with PCR, it's a little easier. But again, that is not worldwide available. And then again, there are varieties of drug resistance, non-compliance to the treatment, crowding, and other factors play a role. And you can see from this worldwide graph that Russia takes the dubious honor of having more drug resistance, and even compared to sub-Saharan Africa. Okay, and that is primarily due to prison conditions and the collapse of Soviet Union. Okay, and so these are some of the newer technologies that are available, and the pulmonologists have borrowed a page from cardiologists that when the bronchi are narrowed, instead of writing them off, they're able to put stents and do something called balloon bronchoplasty. The bronchi are a lot bigger than coronary arteries, so that is a lot more accessible. Okay, technology. So, and during bronchoscopy, various heat probes are applied. The heat destroys the smooth muscle and relieves the obstruction that can occur, which contributes to asthma symptoms. And even some of the advanced cancers, where the airway tubes are compressed, it can be treated. Type of thing. So there are varieties of technologies that are being, and bronchoalveolar lavage helps drain out some of the blood and the mucus and the infected liquids that are there. Okay, and so that it's becoming an interventional procedure type of thing. And there are varieties of new vaccines, including universal flu vaccine, and most recently some of the new drugs that are being introduced for drug-resistant tuberculosis. So there is hope, but unfortunately, the cost of these drugs is going to be a problem as usual. Okay, and again, the major quality of lung disease, especially all over, you can see that the California air quality and the major cities, and we are not too far behind in Tampa about air quality. Okay, and some of the other developing countries have been a bigger problem. Okay, and then again, we must mention control of lungs and respiration is intricately related to anesthesia, starting from the early days of discovery of nitrous oxide, which was treated as laughing gas and for entertainment of the dandies of Britain. And it took until 40 years when and the pain relief from inhalation agents was put two and two together. And the first experiment was done by a dentist, Morton, who convinced the surgeons to use chloroform as anesthesia agent at the famous Mass General Hospital. And that is still, it led to the surgeons to make a statement, and gentlemen, this is not humbug. And again, the purpose of this thing is to use the minimal amount of alveolar concentration to provide complete pain relief and lack of muscle movement. And now, obviously, the things have become sophisticated. The initial agent, the sedation, is achieved with a rapid intravenous agent, including the well-known fentanyl, and that has become notorious with abuse with the fentanyl. And it's a quickly acting agent, and there are varieties of other intravenous agents. And after that, the anesthesia is maintained with various gases, cyclopropane, nitrous oxide, and so on and so forth. And the air exchange takes place from alveoli to blood to the brain, and it's dependent upon the partial pressure and the solubility of the gas that is being used. Okay, and so these are the varieties of factors as to how quickly it is exchanged inside the alveoli and how quickly it is dissolved. So, and again, while watching the vital signs carefully, that you just want to get enough anesthesia so that you can get pain relief and sedation without causing respiratory depression, because one does not ever want to get to the medullary paralysis stage. So, and no, it's an art of maintaining fine balance in the physiological control. And the ways that it works is by working on various receptors and neurotransmitters in the body. Now, what did we not cover so far is the alphabet soup that listed here. PE means pulmonary embolism, which is can occur either after a major surgery when you're lying supine, or just sheer out of bad luck, or one of the more common reason is airline travel, especially got long flights. So it is recommended, just get well hydrated, move around, use elastic stockings. Okay. And the other agent, which we talked extensively during my class on sleep is called obstructive sleep apnea, which is well known and treated with the CPAP machine. Again, and sleep is extremely important, and the big contributing factor for sleep apnea is obesity, leading to sleep apnea, and the oxygen level drops, and leading to retention of carbon dioxide. And your breathing is multiple deep breaths in, no breath for a while, and breathe onward. So that has that effect of increasing your cardiovascular risks, and the mortality is nothing to sneeze at without adequate treatment. Okay. And the other illnesses, CAP means community acquired pneumonia, okay, which again the list is endless, from viral to bacterial to fungal and to aspiration pneumonia. So this is again, that's one of the common causes of death in the elderly. And again, you could see that, yeah, and that was again the big problem with ARDS, stands for acute respiratory distress syndrome. We talked about it earlier, so there are varieties of ways to treat type of thing, that this again talks about the various management levels, maintaining, avoid drowning the patient with intravenous fluids, appropriate antibiotic, maintain oxygenation, whatever way you can maintain supplemental oxygen under pressure, intubation, and ECMO, which we already alluded to, reduce inflammation by appropriate antibiotics, and even antiviral therapy, which was the big thing during the COVID crisis. Other illnesses that we didn't talk about are such as pulmonary hypertension, sarcoidosis, which is an autoimmune disease, and varieties of occupational diseases, which we alluded to. And now pulmonary hypertension is interesting that it was, it is more common than called two types of pulmonary hypertension, called primary and secondary. Secondary occurs either due to lung or heart disease, okay, due to leaky valves or due to scar tissue in the lungs, okay, and the abnormalities between ventilation and perfusion. Primary pulmonary disease is a genetic disease, occurs in young women, and can be very serious. And the varieties of medications have been devised which relax the smooth muscles of the pulmonary circulation. And one of the side effects was that the Viagra or sildenafil was devised initially as a treatment for pulmonary hypertension. And the side effect was more beneficial to the companies, and that's how it was marketed for erectile dysfunction. Again, but so moving right on to it, the interesting side bit that I should mention is hyperbaric oxygen therapy, which has been around for a long time, was used for treatment of bends, okay, and for non-healing ulcer, especially in diabetic necrotic ulcer or in war trauma. But recently, some of the Israeli researchers have used it for recovery of stroke. That in stroke, there is the damaged area that's permanent, inside your brain, but around the area that is suffering but not totally dead, and that area can recover from hyperbaric oxygen. And the way they have used is interesting. That they would they would give the hyperbaric oxygen for a while, and then terminate it, creating what is known as hypoxemia, and that helps recruit the endogenous stem cells and helps recovery of the tissue. And so this is, again, hypoxemia has been recently coming into vogue, and it is associated with aging. And obviously, it became the in thing for uh, uh, eccentric people like Michael Jackson. And the 100% oxygen is breathed at high atmospheric pressure. And you can see this looks inside the coffin. And there are some, obviously, this is not an easy, because it can also cause damage with reactive oxygen species. So it can be beneficial for angiogenesis, means new blood vessel formation, but at the same time can cause scar tissue as well. So it's a tricky treatment, but some of the earlier data that is published by some of the Israeli scientists, who are quite reputable, looks very promising. And just to make complete that, the 2019 Nobel Prize was given for research of hypoxemia, because something called hypoxemia-inducing factor, and it's also intricately related to vascular growth factor. It's called VGF, and it leads to new blood vessel formation. Okay, and this has a relationship with something called erythropoietin, which is the protein that is formed by kidneys and liver in part, and helps regenerate red blood cells and promoting healing. And so it not only just it stimulates the red blood cells themselves, as well as causes new blood vessel formation. So the varieties of factor, the more energy and and the endogenous stem cells helps the process of healing. Okay, and so now this was erythropoietin has been in vogue, and obviously was useful for treatment of anemia that occurs in kidney failure patients, and has also potential for abuse that was abused by the cycling champions, Lance Armstrong, that you may have read about. Okay. Last but not the least, a word about lung transplant. It's trickier than heart or kidney transplant, and but no, there are about 5,000 done worldwide, and the survival is nothing to get excited about. It's only about 6 to 8 years. And the causes include the cystic fibrosis, pulmonary hypertension, chronic lung disease, and it's an interesting video of an unfortunate young lady.
In June 2004, I was diagnosed with idiopathic pulmonary hypertension.
It's a disease in which the vessels that supply the blood to the lungs, they're defective, and the heart has to work harder to pump up against the resistance of these blood vessels in the lung.
Most patients initially are treated with medical therapy, but a reasonable percentage of patients end up failing medical therapy. At that point, their only real option for any chance at prolonged survival is either lung transplantation or combined heart-lung transplantation.
Almost the only thing that was on Charity's mind was, can I continue to sing while I'm on the waiting list?
In that last year, I remember a few months before the transplant sitting on the couch, just working to breathe and thinking to myself, I don't know how long I can do this. I was exhausted from just sitting there and breathing.
We really didn't have a good sense of how sick she was. We knew she was extremely ill. We knew that she needed to get a transplant soon or she was going to die, to be very frank.
We were calling her room in New York, telling her our team is coming together. Charity was flown in the middle of the night.
Okay, we'll stop this for a while, and then she got not just one but two lung transplants, because the first one failed, and then eventually she died a couple of years ago of lung cancer because of the immune suppression. Again, that is has its own side effects too. So that's one of the tragic human interest stories that that's lung transplant related. Okay, and I think we're done for the part, and I'll stop here and hang around for a few questions, and then next week, then part 2 will follow, type of thing, and then so I re-recorded the whole session, and next week we'll delve into gastroenterology. Okay, And hopefully we'll see all of you next time.